I had an interest in medicine early on. My mother had leukemia diagnosed when I was about 4, and so I spent a lot of my young childhood growing up in hospitals and in doctors' offices, and I always looked up to them as the people trying to get my mom home. It was always a big deal whether or not she'd be home for the holidays. So I think subconsciously I really knew I looked up to them and wanted to do that with my life. When a family comes in to see me for the first time, I like to really get to know the child if they're older, and also the parent as well. If the child's younger, I really kind of focus in on getting the child comfortable with me and make sure that they know that I'm not a scary individual. And sometimes that takes time and lots of practice, but I also like to get to know the parents as well and to hear them out on their parenting philosophy and their concerns and issues that they've had so far. When one of our children gets sick, it's not just the child who's affected. Parents get worried. They're very concerned. It affects the family in different ways, like parents having to take off work, grandparents having to stay home with the child, and it's been really nice getting to be able to hear parents and relieve their concerns by taking care of their children.